Hi, my name is Ashley Hurst. I'm a registered dietitian with an IBD-focused private practice, and today I'm going to be going over a study from 2016 titled Avoidance of Fiber is Associated with Greater Risk of Crohn's Disease Flare in a 6-Month Period. The aim of the research, despite 3 decades of research on the role of dietary fiber, previous studies have been weak due to small size or short duration. And despite knowing the benefit of short-chain fatty acid production with fiber intake, IBD patients are often told to exclude or limit fiber. The aim of the study or the design was for it to be a larger and longer study duration. And the main aim of the research was to investigate the factors associated with fiber consumption and whether it was associated with flares in patients with IBD. The methods of the study included 1,619 participants from the Crohn's and Colitis Foundation's Internet cohort. Participants completed a 26-item dietary survey that was optional in the beginning of the study. Fiber and whole grain consumption was also analyzed in this study. And the eligibility for the study included that you must be 18 years of age or older, you must be considered to be in remission as measured by the CDAI score at the baseline, must also not have been on steroids at the time of the study, and they require you to complete a follow-up study 6 months after. The results of the study was that participants with longer duration of disease, past history of surgery, and past IBD hospitalization tended to eat less fiber. And compared to those with the lowest fiber intake, those with the highest fiber content were less likely to flare. They also found that 29% of those in the study avoided high fiber foods. And they found that those not avoiding fiber were 40% less likely to have a flare than those who did avoid fiber. There was also no association between fiber intake and flares for those with ulcerative colitis. Other results included that the highest fiber consumers were male. They tend to be 5 times more likely to be high fiber consumers. They also found that high ulcerative colitis patients tend to be 2.6 times more likely to be in the highest quartile of high fiber consumers. And the highest whole grain consumers were also significantly less likely to have a flare. Some of the strengths and limitations of the study, the strengths were that it was a longer duration than previous studies. It was also a larger size. And in addition to the dietary surveys that they did, which can be a little bit unreliable, they also used 24-hour recalls in combination with that. Some of the limitations were the dietary surveys may be unreliable as they're self-reported. Other limitations were that fiber can also be measured inaccurately. Subgroups of IBD were also not looked at in depth, and the normal intake of fiber that was used was actually below the recommended dietary amount of 25 to 35 grams. So the fiber that was considered normal intake was around the 15 to 17 grams. So conclusions for this study. Results support findings that eating low fiber does not result in improved outcomes for individuals with Crohn's disease compared to individuals with Crohn's disease that are not restricting fiber intake. More research is needed to explore the causes of fiber restriction in Crohn's disease. More research is also needed to explore the potential benefits of fiber-containing foods in the diet of individuals with IBD, especially in specific phenotypes. So I'd love to hear what you think of this study. Feel free to leave a note in the comments with your thoughts.